Good morning, friends on YouTube. Erica Hammond here with type 1 diabetes for 25 years. Today's video is going to be a little more in depth about the insulin pump therapy because I've had some questions about it. And what I would like to say first is that I don't think I would ever go back to insulin pens or shots just because I really love the convenience of having insulin wherever I am and not having to leave class or a meeting or anything to take insulin. I can just check it discreetly and give myself some insulin whenever I need it. So I'm going to go ahead and get started and just show you first of all my pump, and it's the 670G. It's right here, and it has 300 mil like a tank that just goes inside of it, and then there's a screw that goes around that puts a little bit of insulin up to like 1/100th of a unit actually. So just very tiny amounts it can give. And then the end looks like this, and then you can just clip it on to the site once it's inserted into your body. And the insulin pump site looks like this. And this is called the Quick Set Paradigm, and there's a little needle inside of here, and this part comes off once the needle's inserted and the little cannula is in your body. Then you can pull out the metal part, and then this little round part is adhesive around here. This is just protecting the needle right here, and then the tubing, of course. And so what I like to do is make sure I've just had a shower, or sometimes I'll use alcohol wipes or like a skin protectant for IV prep wipe or something like that to get ready to insert it. And then it comes with the little inserter that looks like this, and you just can pull that back and it kind of cocks it, and then you put your little insulin or your infusion sites inside there, and then you cock it back and it goes down inside, and then it has little buttons on the side that when you push it, it just pushes it right into your body. And it looks harsh and it kind of seems scary at first when you're doing it, but it's not really scary after a little while, and you get used to it. And sometimes, occasionally I'll hit a nerve and it will really hurt, and I'll just say, ouch, But most of the time, if I get it into those nice thick layers on my legs or the back of my arms, then it won't bother me and it won't hurt. So it takes some getting used to reinsert it, but I reinsert mine every 3 days or twice a week is what I try to do, because it makes it more easy to manage than every 3 days. So I insert mine on Wednesday night and Sunday morning, and so that it's kind of 3.5 days, so that I can remember when I'm supposed to be doing it, instead of trying to randomly say, oh, it's been 3 days, and my life just gets way too busy for that. So Wednesdays and Sunday mornings are good for me to reinsert my infusion site. And the CGM site is completely separate from this site. You can't have the insulin going in right near the CGM, because it would affect that, the reading on your blood sugar. And so another thing I wanted to show you is that on the 670, a little blue shield means that you are good to go. And as you can see, my blood sugar is a little high. I think I've had some dawn phenomenon going on for quite a while, where your body just puts out sugar and different chemicals to make your blood sugar rise when you get up in the morning, because I haven't eaten anything. Another thing I wanted to show you is if you push a little button right here, it shows a graph of your blood sugars, and it's really awesome. And if you can see the little purple dots at the top, those are the little tiny bits of insulin that my pump is giving me every time it checks my blood sugar. There's an algorithm in there that makes it give you the insulin according to the rise and fall of your blood sugar. So I know for certain that right over here where my blood sugar is going up, then my pump will start to give me more per little dose, kind of like a fluctuating basal rate. And usually in other pumps that aren't on auto mode, that can't give you insulin according to your blood sugar, your doctor will help you set a basal rate, and that's what I've been on for most of the time I've been on insulin pump therapy until the 670, which is amazing because in auto mode, you're supposed to be able to get your A1C down to normal range, like in the 5s and 6s, which is really amazing for diabetics. And I think that this pump really can help you do that. Now, some people say, well, can you put your pump in now and just forget it? Is it just does it take care of itself? Absolutely not. It's still a big job to take care of your diabetes with an insulin pump. And the reason being is because you do need to calibrate it up to 3 times a day. And then you also have to watch the rise and fall of your blood sugar. You still have to count carbohydrates and bolus according to those. And even if you're on like a keto diet, like I've tried, you still have to count for some of the protein. If you have so many grams of protein and you're not eating any carbohydrates in your diet, then you have to kind of count that for some carbohydrates, because your body will convert some protein to carbohydrates if you're not eating carbohydrates. And so about half, if you have 7 grams of protein, say like 4 of those would be counted as carbs for your insulin. So insulin pump therapy is awesome. And another question I had was, does it hurt while it's in you? No, it doesn't really hurt. I can forget about it usually. There are some times when it gets irritated, for one reason or another, and they can get infected. They can, but if you keep yourself clean and keep, sanitary and things like that, it shouldn't get infected. And then if it does get infected, be sure to put some triple antibiotic ointment on it so it will heal up, and just make sure you take precautions so that it won't get infected. Also, the adhesive can give your skin a rash because it doesn't like it on it for that many days, and sometimes I'll really scratch and it'll get irritated where I have inserted it. But overall, it's been really good, and I haven't had a lot of infections in my infusion sites or my CGM sites. So it's been pretty awesome, and I would like to recommend, if you are considering getting on insulin pump therapy, that you look at all the different pumps out there, the Animas and the Medtronic pumps, and I know that there's another one that I'm forgetting right now. But if you just kind of compare all of them and see which one best fits your lifestyle, that would be great. Another thing is to consider the Dexcom is really an accurate CGM. If you're going to get a pump with a continuous blood glucose monitoring system, you want one that's really accurate and that can last a long time. And so the Dexcom was amazing when I was on it, and I hope that one day I can get on the Dexcom Animas pump and have it be, but I'm kind of waiting for them to get the auto mode on it, because I've been spoiled to have an auto mode pump. And once you get on auto mode, you kind of never want to go back, because it makes you feel kind of normal, like that you're getting more or less insulin according to your blood sugars, and that's pretty awesome. And so if you like this video, please share it with your friends and diabetic friends, and please subscribe to my channel, and have a wonderful day.